Many at this Ottawa Christmas market are already scaling back expectations.
We were supposed to have a get-together with my research lab, but it got cancelled basically almost last minute.
Now we're thinking we might just do like presents outside and then go back home.
I was going to go to Turks and Caicos, but with COVID and everything going around so quick, we just canceled it last minute.
Ottawa's case numbers are mirroring Ontario's, jumping to heights not seen since this spring. As new restrictions on indoor gatherings came into effect, Ontario announced more than 4,000 new cases, fast approaching record levels while other provinces break them. Nova Scotia posted 476 new cases, Quebec 3,846. And yet, at Trudeau International Airport, some holiday travelers pressed on. Boosters are thought to bolster protection against Omicron, but Quebec is only opening them up to those 65 and over starting Monday. They'll be available to all adults in Saskatchewan, where free rapid tests are in high demand.
I'd like to be able to test myself before seeing family members over the holidays.
But access to rapid tests is uneven, and according to experts, they won't be enough.
Pick a small number of people, be around them, be content, be close to home, wear masks, really concentrate on outside activity if you can. If you're inside, go with ventilation, up your mask game.
We have very limited capacity in the country now, so we have to be very careful. It's the transmissibility of this that is very worrisome.
In Vancouver, people have been lining up for the more accurate PCR tests. BC will impose new restrictions on Monday. For the first time, Omicron has now been detected in the Northwest Territories. While case counts rise in nearly every part of the country, Newfoundland and Labrador put in restrictions on new travelers.
The specter of a surge is on our doorsteps, and we need to address it now before we suffer the same fate.
Starting Tuesday, everyone entering that province will have to self-isolate for 5 days and take a rapid test each day, even if you're triple vaccinated. Rafi Bujikani on CBC News, Ottawa.
Well, let's talk a little bit more about the number of positive cases, particularly in Ontario. Dr. Zane Chagla is an infectious disease doctor. He's in Mississauga. And Dr. Chagla, just over 4,000 new COVID cases confirmed in Ontario. But you feel the actual number is much higher.
Yeah, from just being on the ground, it's taking a long time for people to book tests. The assessment centers are filled. Tests that are being done today were people that were booked 3 to 4 to 5 days ago. And so recognizing that a lot of people, aren't even able to access these tests, knowing people that have been diagnosed only based on rapid tests alone and their families are positive, it's likely we're seeing something like 15,000, 20,000 cases instead of this 4,000. And I think unfortunately, case counts are not going to be accurate for the foreseeable future.
And you'd like the testing to be more strategically directed?
Look, we have therapeutic options that can target patients at the highest risk of hospitalization, breakthroughs and not breakthroughs, and people that have been unvaccinated. I think we have to identify people who are high risk, people who work in high risk settings, and let them have priority access to testing. And unfortunately, people who are at low risk may need to just stay at home and ride out their symptoms in isolation as compared to getting a confirmatory test.
All right, Dr. Chagla, stand by. You and Dr. Alex Wong will be here later in the program to answer some more questions.
Thanks.